Hey, hello everyone. Good morning, good evening. I hope you're well wherever you are from whichever part of the world. Welcome again to this iteration of the CARPL's Unboxing AI webinar series. I know it's two new faces for you. We've been trusted with this massive responsibility by Vidar, but we are really delighted to be taking this forward with today's session on the dev D, the D aspect of our approach. I'm Suyash. I'm a trained physician. I work with CARPL as a clinical solutions architect on the healthcare provider side. I am joined by my dear colleague Atharv. Atharv, why don't you introduce yourself?
Yep, absolutely. Thanks, Suyash. Hello, everyone. I am Atharva. I am a data scientist by training, but have been working here at Kapil as a senior account manager, now managing our clients across Southeast and East Asia.
Essentially, for people who are joining in for the first time, CARPL is an enterprise imaging AI platform. We connect two different ecosystems. Athar is going to walk you through what it is that we do. But essentially, think of us like your link into the AI ecosystem, a beginner's tool guide, a professional's gameplay arena, but essentially all encompassing every single aspect of radiology AI today. I'm going to share my screen, and my colleague Atharv can then begin this session essentially.
We can see your screen, Suyash. So I think we'll start by covering what Vidur has already walked us through previously with regards to Kapil. As you all know, we are an enterprise imaging platform. Um, as Suyash correctly mentioned, we primarily connect the world of AI applications to healthcare providers, allowing doctors to uh, use AI to actually improve patient outcomes. Um, we are the only FDA cleared and CE marked AI platform in the world, and we are the only AI platform that actually allows you to validate and test your AI solutions before you actually clinically use them. We also have an FDA approved AI viewer, universal AI viewer, which allows you to view these various AI applications in a single user interface. And we also have an interesting, non obtrusive, and extremely powerful universal AI widget as well that we'll cover in our session today. Another thing to make note of is we are the largest marketplace in the world. I think as of last counting, we have over 154 AI applications on our platform as per our friends at Signify Research. And on the right, you can see the banner which spreads across the slide covers all of our AI applications across the way we like to organize them or attempt to organize them is by body part, modality, and then use the AI application. We haven't grouped them by pathology. I think that there are too many to cover, but yeah, this is what we do, and we are used by top radiology groups across the world. I think the intent of this session is to cover our core philosophy or our core framework, which is a two-step approach, which we like to call DevD. It is an ode to an Indian classic. All our Indian viewers would know Devdas, but it primarily deals with discover, explore, and validate, where we want healthcare providers to be able to find out about all of the various AI applications that are in the world. Over 100 AI applications, hundreds or thousands of AI applications that exist. A single seamless channel to actually discover these. By explore, what we mean is we want you to be able to run this AI on your own data and be able to actually look at how their outputs look like. Do they make sense? Do they actually help you? And not just that, but with our validate toolkit, what we want you to do is statistically validate these AI solutions and be confident in how they perform on your data set from scans acquired from your machinery so that you can be confident in actually going ahead and deploying them in clinical practice. Uh, CARPL as a platform, as you can see, covers all of these various components to allow you to do that. And the beauty of CARPL is that we are modular. I'll jump into that a little while later, but going into validation itself, as Vidur has previously covered, CARPL has a powerful toolkit that actually allows you to statistically validate the performance of the AI application. You can validate all of the various AI applications that we have on our platform using this single toolkit. We try to empower the user so that they can not just see how the algorithm performs, but they can also evaluate for various things such as biases, and ensure that the algorithm works well across the various groups of data and patients that come their way. Also, CARPL intends to be a partner in your AI adoption journey. So we don't just stop at validation, but once you actually clinically use an AI solution through us, we're there to support you in actually monitoring the AI solution as well. And the value that the AI solution commits, you using CARPL will be able to evaluate and be able to measure how the AI solution actually performs, and does it continue to deliver that value, and if it continues to perform well as expected. I think jumping into CARPL as a platform, as I previously mentioned, CARPL is modular. The beauty of CARPL is that all of our components can be deployed across a variety of infrastructures. So, for example, CARPL can be deployed on a box within within a data center of a healthcare provider. We can very seamlessly deploy on private cloud. We can deploy on public cloud as well. And so it is extremely flexible in allowing the healthcare provider to deploy CARPL as a solution within their practice in a manner that they prefer. This slide illustrates the same, showing how various components can be deployed in different ways. And across the globe, we've deployed in these variety of manners. I think covering validation now, we'll jump into the main agenda for today, and I'll request Suyash to actually walk us through the challenges with deploying an AI solution within clinical practice and how CARPL helps alleviate those challenges.
No, thank you so much, Atharv. I think as a summarization, that's pretty much the journey that we like to work on with our radiology partners. Um, However, in terms of the deployment of these applications and the way the ecosystem is built out today, it's about deploying multiple point solutions together to truly deliver that encapsulated value within radiology workflows. So, how does a single plug and play integration platform truly solve? What is the challenge that we're trying to solve? Again, for each of these solutions, there are different output formats. There isn't a single standardized versioning from all of these applications. Each of these require their individual infra specifications. They also demand their own user interface, making it particularly challenging to deploy within a diverse risk-back system for any radiology group, any imaging practice. And that's where we as a platform bring that vendor-agnostic integration, giving a single standardized interface to truly drive the adoption and the augmented workflow, as we like to call it. And over the past couple of years, we've significantly worked on ensuring that this is done through a radiologist-centric approach while maintaining a vendor-neutral approach to this whole operation from a CARPL platform perspective. So we've helped build out these partnerships with different PACS vendors such as Philips, AGFA, RadNet, IntelliRad, but while remaining as a vendor-neutral entity to support clinical deployment truly from that seamless adoption perspective. So the way we do this is in one of three different ways. The first one is a simple quicken methodology for us to push all of the secondary capture outputs, all of the structured reports directly into your risk pack setting. And we do this essentially as a simple DICOM push with the standardized outputs as they come in from the vendor's perspectives. We also work on the worklist, so allowing report auto-population, worklist prioritization, alerting workflows to generate that operational efficiency for radiologists. And this is more so seen in case of those triage algorithms, the fracture detection in the emergency room, the stroke detection, the incidental pulmonary embolism detection, all of these tools that have displayed high operational efficiency, high gains from a radiologist perspective. One of the key challenges we've seen in this method coming in as more and more folks start deploying, start running these applications at scale, is having some of these outputs sit in on your PACS system as part of your patient jacket can potentially open you up to medical legal challenges, medical legal possibilities, because they may contain false positives occasionally. So the ability to insert the radiologist within that decision-making workflow, that's the kind of space that CARPL has really been working on for these past few years now. And one of the ways we do this is by leveraging our FDA-cleared universal AI viewer. Essentially, having that viewer sit in context with your PACS system, opening up any study as soon as there is an AI output attached with that particular patient profile or that patient study. So it would sit in as part of your hanging protocol, essentially occupying some real estate, but giving you as a radiologist the opportunity to add in real-time feedback. You can generate these templates beforehand, have them as standardized template for specific studies that you're reviewing, and then generate your own accept reject workflow based on your assessment of what acknowledgement exists on these particular outputs. You also have the ability to annotate on the fly to make any markings that you believe is important to note within that particular study. Now, this is again a really used feature of ours across some of our user base. But what we've realized over the past year and a half or so is having this similar setup where the radiologist is part of that decision making, part of that interactive workflow in the loop at all times, and having that in a more minimally obtrusive manner is by leveraging our universal critical alerting widget. So the way we do this is all of the outputs that will be visualized are through our critical alerting widget. So the widget would sit in as this minimally obtrusive. You can place it anywhere and displays a high degree of customization for the users. And it allows you to truly demonstrate an output from this AI application, visualize it on the widget itself, as you would see here, and based on your assessment, you can then generate an accept reject kind of workflow. Again, this is very similar to what the viewer does, display all different kinds of DICOM outputs as they come in, making this the standardized user interface for radiologists to truly consume this. Again, we take this a step forward. The widget also can act as an alerting system for radiologists for any study that's been inferenced in the background. So say we're looking at a non-emergency study from the outpatient setting, but we've got an ER study for a stroke that's just come in, and the AI application will ring a bell icon of sorts, allowing you to give you an alert essentially and visualize what that output says, and then invoke your PACS to that particular study and report it at the earliest, allowing you to truly generate that stat reading workflow. So using both of these two use cases, we leverage the widget to support radiologists to truly maximize the operational efficiencies that are possible using these AI applications today. Again, maybe just one more slide, and then we can chime into some of the Q&A as I see they're popping in now. While what I just mentioned was on the imaging front, there is the whole aspect about these applications now based on the regulatory approvals, also sending in structured reports. Now, these are what truly help augment workflow because they're sending you essentially a newer starting point while reporting some of these studies. So the way we do this is using our HL7 and FHIR integrations to push any structured report outputs back onto your reporting system, being completely agnostic about which system you're using for dictation, which system you're using for report summarization, allowing you to also ensemble some of these applications together as more and more such tools come into our ecosystem and leverage all of these in a future-proof manner to impact the operational gains from a radiologist perspective. Again, now I think Atharv, it may be a good time for us to maybe dive into some of the Q&A. I think because I have my screen shared, do you mind reading out any of these questions?
Absolutely. I think we have a couple of interesting questions, Suyash, that have come up. One of the questions is with regards to the widget and our universal AI viewer. An anonymous attendee asks us, could you dive into the medical legal issues a bit more? What does it mean for AI applications who don't have their own widget or viewer? Can they not be deployed?
Absolutely. Yeah. I think that's such a brilliant question. And the reason we like to call these the viewer and the widget a universal widget is because we form that standardized interface supporting any application on the market to be leveraged through that same interface. So they may not directly have their own widget or a viewer workflow today. But the CARPL widget and the viewer would enable any such AI developer to also leverage these to its maximum capabilities. Now, I just want to take a minute to also talk about the first part of the question about these particular medical legal challenges. Now, we're seeing in the ecosystem a lot of tools that also look at oncology screens come up extensively. And that's where we find that while a radiologist may have all of these outputs sitting in their PAC system, let's say there's a lung nodule detection tool, it's detected 10 different nodules on a particular study. As a radiologist, I may agree with maybe 8 of them. And I've made a note of this and finally drafted my report and put in all of the requirements on those 8 particular nodules. Now, because that is still sitting as part of the patient jacket and PACS being immutable, it's constantly going to be there, available for any referring physician, any patient who has access to their EMR, has access to their PACS records to access. And this can potentially pose challenges if it is subpoenaed or if there's a review of that medical record. And so in such scenarios, it helps to have either the universal AI viewer, which is FDA cleared, or the widget as that interface where radiologists are allowed to make that decision while being in the loop based on their assessment. So that's the kind of thought process and how both the viewer and the widget support all AI vendors across the ecosystem today to leverage the infrastructure that's possible to its maximal capabilities to allow radiologists to leverage their value.
Awesome. Thank you for that answer, Suyash. I'll read out another question that we've received from Todd Alman within our chat. Todd asks us, do your customers store all the data, AI data, into their archive? And maybe I can take a stab at it.
Yeah, I was just about to say.
Absolutely. So I think, Todd, it entirely depends on what our customers wish to do. Should they want us to push back the AI output within their packs or share it with them so that they can archive it? That is something CARPL can help do. But otherwise, all of the AI that we process and that is made available via our universal AI viewer or universal AI widget is retained on the CARPL platform itself as per the hospital's data retention policies. So yes, again, there's flexibility there based on the hospital's preference.
And just to maybe piggyback on the last point that you mentioned, across what you'll observe across all of the D, as we like to call it, in terms of deployment, we've come to this point where essentially in the ecosystem there is no one shoe fits all for everybody, and therefore having an onslaught of options essentially allows health systems, allows imaging practices to use and leverage a system that works best for them, whether it's a direct integration with DICOM outputs, whether it is a worklist based prioritization, that's optimal for their reader workflow, whether it's the FDA cleared viewer that sits within their packs, allows them to have that as the standardized interface for an MR output, a CT output, even an ultrasound output for what it's worth, or the widget as a minimally obtrusive. So it's entirely up to the health system to design their own workflow and then allow radiologists feedback to come in. And that's the support that we like to work in as a clinical technology partner for our health system buddies. Atharv, please go ahead.
Thank you so much for that, Suyash. I think another question that we have from Manish within our chat is, how are AI workflows being integrated into the IHE profiles?
Do you want to take
that? And he follows up on that with another question, like driverless cars have levels, AGI as per OpenAI has levels of AGI. Are there levels of AI for radiology workflows, ranging from a human in the loop to a completely automated workflow with radiologists being a final approver?
I think that's a very good question. Atharv, do you want to take that or?
Absolutely. I think answering his second question with regards to there being levels, yes, there are absolutely levels to these AI applications that are approved for clinical use. This is based on the regulatory approval that they receive, based on how critical these AI applications are. But in terms of their utility, they act as clinical assistive tools. So the idea is to assist the radiologist in making a decision, and the radiologist remains as a final approver. As we jokingly like to say, we aren't here to replace radiologists, but what we want to make are super radiologists. So radiologists empowered with AI.
And I think there's a conversation about these applications now as the ecosystem evolves, as I mentioned now, with foundational models coming in, with multimodal tools coming in, and Gen AI kind of supporting all of the deep learning algorithms as they've existed in the ecosystem. There is a conversation about where the regulation stands on this. I believe that is a primary driver when it comes to some of these autonomous tools, as we like to call them. There are in the FDA sense today, there is no single autonomous application that exists. There are still point solutions, whereas some of the other geographies and their regulations have been more supportive in terms of allowing some of these applications to truly be autonomous in their reporting. There's, of course, a chest X-ray tool that supports autonomous normal reporting of X-rays, wherein only a radiologist sign-off is essentially required, and they've been able to demonstrate significant value that there will be no finding that is being missed. So I think it's a question also about trust building between radiologists and autonomous tools. And I think the pathway to achieving that trust comes in from leveraging first the values that exist within these workflows, whether you maximize a study being pushed up in your worklist, look at it in your packs at the earliest, see if there's a fracture present, reported stat, and then coming to the ecosystem where you will have more such tools that allow you to also generate reports within regulatory confines, of course, that would then allow that kind of a complete automation process, truly allowing, as Atharv mentioned, the ability for us to support super radiologists in the workflow and not being burnt out as most radiologists are today. I know we're getting more questions in.
I think, yeah, there are a lot of questions, Suyash. Some of our colleagues and friends are asking us to do a quick recap of the DevD framework, and also there's a request from our colleague Bhanushri to actually jump into our post-deployment monitoring capabilities as well. Do you think we have time to cover that? Maybe we could just...
Yeah, I think we could do a quick minute summary of the dev approach. I think essentially what Atharv walked through and what Vidur's talked about is the ability for us to deploy applications is like a beginning point in terms of a clinical adoption journey. But before that, it involves decision makers who would invest time in discovering exploring these tools and validating whether these are tools on the marketplace, tools that are in-house built, validating them to see is there clinical, statistical, economical value in running these applications. And once we deploy them, it's the beginning of the journey as well, because now we need to maximize the ROI. Always insist on ensuring that we have the value, as Atharv mentioned, coming into your clinical workflow. So we use the same monitoring tools today to see, are we supporting radiologists? Are these applications in concordance or discordance, whether that's on a user level, on a group level, supporting dashboards presented to the chairs, presented to key decision makers to show, the application that you deployed, is that bringing value to you at regular intervals? Now, that value can be defined clinically, operationally, or financially. And we like to present that framework with accurate data points to key decision makers so that they make an informed decision that's not based on the application's marketing, but more so on data performance basis on your local application space. So the monitoring platform today exists, to present to you concordance discordance rates of whether or not there is, what is the AUC, what is the specificity, and we do this by tracking the AI outputs coming in, as well as the final reports that are coming in from the radiologists who are looking at the outputs and drafting their final reports. Now, there is another methodology of monitoring that we use, which is more so in the research domain today, but that involves us looking at it from an autonomous perspective, an autonomous monitoring platform, wherein we're simply monitoring the distribution of probability scores, negating the need for the final reports, eliminating any kind of automation bias that would have come in to drafting those reports. Again, I think maybe we can invest some time in a new session to deep dive into what that monitoring tool looks like. But just as a summary, that's where we enable monitoring. And it is pretty much the cornerstone of the platform, because validation is not the end all point. It's more so the beginning of adoption, and then ensuring that we're constantly meeting those benchmarks that we've set with these applications.
Thank you for that, Suyash. I think we have a couple of more minutes to take a few more questions. We have a question from Breda Drury asking us, how does patient health information compliance like HIPAA, etc., work whilst working with multiple AI developers and applications into CARPL?
Yeah, I think Atharv, you could take this question.
Sure, absolutely. So, Preda, this is achieved via our modular interface, and primarily the component of CARPL shown here as the CARPL router. This is a component that sits within the healthcare provider's infrastructure. So in case it's an on-premise PAC system, this component is deployed within the healthcare provider's data center. And what it is tasked with is receiving data, de-identifying it so that the DICOM files are stripped of any PII, and then they can be actually shared outside on cloud if that is the manner of deployment for CARPL, or it could be shared to the CARPL platform within the same data center itself, where the AI applications reside for processing. So prior to data being sent out of the hospital's environment, it is completely de-identified and removed of PII before it being processed via the AI application. So that is how we ensure that we maintain compliance.
I think we're just at time now, but we'll try and tackle all of the questions. We'll send you responses. We'll be thankful to our team so that we can connect with you. And this has been thank you so much for joining in, everyone. We've had a delightful discussion. I've loved reading some of these questions, and they're thought invoking for all of us here as well, requiring us to always think about what is coming in the ecosystem, what is it that we build for, so that we are future proofing for our users, our partners all around the world. Maybe a word from you, Atharv.
Oh, thank you so much. I think that's a wonderful summary, Suyash. And just as a reminder to everybody who has joined in, this session is also available on YouTube. And all of our previous sessions as well are within on our YouTube channel within a playlist. So please feel free to go through them again. And should you have any questions, do reach out to us. Thank you so much.
Thank you, everyone. Take care.